It starts with a simple cough. A little fever. Maybe catarrh, but in overcrowded, poorly ventilated rooms, that same cough can become something deadly. Pneumonia. Pneumonia is an infection of the lungs that causes the air sacs, called alveoli, to fill with fluid and pus. It makes breathing difficult and starves the body of oxygen. It's responsible for millions of deaths each year. Yet, it's preventable. The airways are divided into the upper and lower respiratory tracts. Upper respiratory infections affect the nose, throat, and sinuses, what we often call catarrh, flu, or sore throat. But when the infection drops into the lower tract, the bronchi and lungs, that's when pneumonia develops. It's no longer just cough. It's a fight for breath. Normally, your lungs have natural defenses. Mucus traps germs, and tiny hair-like cilia sweep them away. But when your immunity is low, from malnutrition, overcrowding, smoking, or viral illness, those defenses break down. Bacteria or viruses invade the alveoli, triggering inflammation. The air sacs fill with pus and fluid, reducing the surface area for gas exchange. Oxygen can't get in. CO2 can't get out. The body begins to suffocate, slowly. Symptoms vary with age. In adults, cough with yellow or rusty sputum, fever, chills, chest pain, and shortness of breath. In children, fever, cough, fast breathing, chest indrawing, inability to feed, or bluish lips. All red flags. On examination, doctors hear crackles, tiny bubbling sounds, and sometimes dullness on percussion, or reduced breath sounds in affected areas. Pneumonia thrives where defenses are weak. Overcrowded rooms, poor ventilation, indoor smoke, cold weather, malnutrition, HIV, and incomplete vaccination, all increase the risk. A child sleeping in a stuffy room with smoky air is already in danger, even before the first cough. Most pneumonia cases are caused by bacteria like Streptococcus pneumoniae, others by viruses, especially after a flu or cold. And in weak immune systems, fungi can be the culprits. Treatment depends on the cause and severity. Bacterial pneumonia is treated with antibiotics. Viral pneumonia is mostly supportive, fluids, rest, oxygen, and fever control, but self-medication is dangerous. Wrong antibiotics can worsen resistance. Severe cases must be treated in hospitals, sometimes with oxygen or IV therapy. You can prevent pneumonia. Ensure full childhood vaccination, especially against pneumococcus and measles. Keep rooms well ventilated, avoid overcrowding, breastfeed babies, it boosts immunity. Stop smoking and reduce indoor air pollution. Treat coughs and colds early, before they worsen. Pneumonia may be deadly, but it's not unbeatable. Early detection, good ventilation, vaccination, and awareness save lives. Share this message. Someone you know may be coughing right now, unaware of what's coming.
If this video opened your eyes, don't keep the knowledge to yourself. Tap the like button, share with someone who coughs too much, and gently subscribe to this channel for more health tips. No side effects. I promise, just healthy information every week.